Welcome to Barbados Fertility Centre's Menopur injection instructions. My name is Anna Hosford and I'm going to walk you through this step by step today. So, when you open your medications, you're going to see a box like this, Menopur, or you might see a box like this, Merional. These are the same medication. They're both HMG, human menopausal gonadotropin, which is used for stimulating the ovaries to produce the eggs. They both come as a powder and a water, and I'm going to teach you today how to mix the powder and the water. For some patients, you will also be on an FSH, which is called Fostamin or maybe Gonal F. Normally people get Fostamin. If you get Fostamin, it is also 75 international units, and it also comes as a powder and a water, and you will mix this with the Menopur or the Merional so that you just have one injection, which I'm going to show you now. For demonstration purposes today, we're going to use the Menopur. This medication comes as a powder and as a water. The water is simply for dilution. The powder is the medication, and each powder vial is 75 international units. For some people, you're on 2 powders per day, some people 3, some people 4, etc., until you get to the maximum stimulation, which is 8 powders per day. Your nurse coordinator will have advised you how many powders of Menopur or Merional or Fostamin you will be taking every day. For demonstration purposes today, we're going to use 3 powders. So you're going to do this injection in the evening. It's going to be every evening around the same time. So to do the injection, of course, wash your hands. That's the first thing you always do. Then you're going to take out the designated number of vials that you're on. In this case, 3. 1, 2, 3 powders. Regardless whether you're on 2 powders up to 8 powders, you're only ever going to use 1 water vial for dilution. So you're going to have lots of waters left over. Just throw them away. You won't need them for any other use. You'll also get a syringe like this. This is when it's opened. You'll get a big needle, which is used for the mixing process. And you will get a small needle, which is for the injection. The first thing you're going to do is you're going to attach your big green needle. It's a twist on, twist off mechanism. So you're going to twist it on nice and tightly to be sure you don't get any leakage. Then you're going to pop off the tops of these vials, and underneath you'll see a rubber stopper seal. To open the water, the first thing you need to do is you need to tap the water vial, because oftentimes some water will get stuck up in the top of the vial. So give it a flick. Be sure all the water comes down. There's usually a dot, a blue or a red dot on the glass vial. You're going to turn this vial around, pointing it towards your nose. With your thumb and your forefinger, you're going to push it back. It snaps off very easily. What you don't want to do is you don't want to squeeze it, because if you squeeze it, you'll crush it. If you do, just get another water vial and try again. Don't use the one that you crushed in case any little bits of glass fell in. It's just a pushback mechanism. Don't forget, don't squeeze the top of the vial. Then you're going to take your needle and syringe. With every needle, there's what we call a bevel, which is like a flat part. It's very important that you look for this, and when you're doing the injections, you're going to keep that bevel against the glass. That helps you get every drop in the vial. So you're going to take your needle with your bevel pointed down. You're going to draw up, being sure you get every drop of the water. Then you're going to go to your first powder. Pretend this is a powder. Hold it like a little dart. Push your needle through the rubber stopper. Often there's a vacuum in this, so by the time you push it in, the water is already being dragged in by the vacuum. If you see that there's a few drops in and the powder's gone, don't worry, there was powder in there. There's powder in every one. It's just that the minute the first water drop hits the powder, it dissolves instantly. And you're going to push it in. Be sure you push all the water in, again, nice and gently. You don't want it to bubble. Find your bevel. Put it against the flat part of the glass. And you can bend this needle a little bit. It won't break. Bend it and draw it all out. being sure you get every drop. When you're pulling out this needle, again, because of the vacuum, you want to be sure you hold it at this part here. If you release it to hold it here to pull it out, it might suck some of the fluid back in. So if you pull out the needle and you see there's still some left, it's probably because of that. So to withdraw the needle, you're going to hold it back here and draw it out as one unit. Then you're going to go to the next powder vial. Inject it in, draw it back out. The next one, inject it in, draw it back out. And you're going to keep injecting in, drawing out, injecting in, drawing out until the allocated number of vials that you are on are dissolved and drawn up in this syringe. If you're on the Menopur and the Fosterman, you can mix these together in one syringe with one water so that you only have one injection. And it doesn't matter whether the water comes from the Menopur box or the Fosterman box, they're both exactly the same. When you're finished the mixing process, you're going to draw back. If you get air as you're drawing along, it's no big deal because you're going to get rid of it at the end. Don't worry about the air. But at the very end, you're going to point the needle up because air always rises to the top. Pull back on your plunger to be sure you don't waste any medication in this big green vial, in this big green needle. You're going to put your cap on the needle, and it's a twist off, twist on mechanism. So you're going to twist off the green. You're going to get your little small needle for injection, and you're going to twist it on. When you twist it on, be sure it's nice and tight as well, and then you're going to pull off the cap. This is when you what we call prime the needle. So you're going to flick it, be sure all the air rises to the top, and then you're going to push out nice and gently. Don't push it too hard or you'll get a squirt of medication. Be sure your air is out by looking for that drop of medication at the needle tip. And then this injection is also done in your thigh, okay? With your thigh, you're going to look for some fatty tissue in the upper outer aspect of your thigh. You're going to wipe with your alcohol pad or your surgical alcohol and cotton pad. You're going to hold it down here like a little dart. Don't hold it back here, it's not stable. Hold it here like a little dart. You're going to pinch the skin and you're going to insert the needle at a 90-degree angle in a darting motion. Don't go slowly. If you go slowly, it's just going to hurt a little bit more. So you want a nice firm dart, okay? Once the needle goes through the skin, it'll slide the whole way in. Then you just go back to the plunger. You push on the plunger till all the medication is injected and you pull the needle out. When you pull the needle out, you might get a little drop of medication come back, a little drop of blood come back. It's no big deal, just give it a rub. This injection is 1 ml of fluid, so it does sting a little bit. This is normal, don't panic about it. And even though the drip of fluid that comes out looks like a lot, it's really not, so don't worry about that either. This is the medication that stimulates the ovaries to produce the eggs. So as you're giving it day after day, your estrogen levels begin to rise. So any nasty side effects you had to the Buserelin, the Lupron or the pill, they'll all disappear because this medication gives you estrogen back in your system, and this is good for women. The only side effect really is pain at the injection site, but also maybe a little bit of abdominal heaviness or discomfort as those ovaries do begin to grow and develop multiple follicles. Good luck.